My name is Babaian, and I am the owner and operator of Vape New York Advanced Electronic Cigarettes. We've been in business since 2011. We make it a policy to educate and convert smokers to electronic cigarettes and advanced vapor products in order to help them switch entirely from cigarettes to vapor products. So just to clarify what a vape shop is, there are a lot of places that sell vapor products. There are convenience stores, gas stations, and sometimes pharmacies in states where it's not banned to sell them to sell vapor products in pharmacies. But vape shops sell only or primarily vapor products. They do not sell cheese doodles. They do not sell candy bars. They do not sell sodas. They generally sell only vapor products. There are three main types of styles. Type is a boutique or lounge type style of vape shop. Generally, these have little areas where you can sit and be social and chat with other friends, and it provides an environment for support to learn, from other people who use the product and share with other people who use the product. Then we have a bar style where you're having more interaction with the retailer, the salespeople, the managers. So it gives you more opportunity for education, and the interaction is less with the other consumers than with the people that are selling the product. So you're having more interaction time with people who are educated on the product. It also gives you the opportunity to try different flavors and different devices because you're at the counter where you have access to the different products that you can sample and try, which is often very helpful as well. Then we have the smoke shop style, which as you can see has more display areas so you can see and view more of the product, but there generally isn't the opportunity to try the product, which seems to be more important in choosing the correct product. The educational experience is not as good, and generally people are not taught how to use the product. They're sold the product and sent home, which doesn't provide as much opportunity for education. So the bar style and the lounge style are generally designed to encourage long-term visits. By having the person in the shop longer, you are extending their educational experience, giving them more time to learn about the product and how it works. You're increasing their product exposure and the number of products that they try and the number of products that they're able to view and handle. You're also increasing the number of different flavors that they may be able to try or be exposed to, which means that all of these things are going to give them a higher likelihood of succeeding at complete transition to vapor products. Finding the right flavor is absolutely imperative. If they find the right flavor, they're more likely to use it. If they use it more frequently, they're less likely to smoke. Numbers on this slide come from a variety of sources. Not all of them are listed because I could not fit them, but feel free to reach out if you'd like any of them. Based on 9 years experience and a number of studies, both in the US and around the world, average age of the vapor that comes into the vape shop is about 44 years old. Nearly all of them are former cigarette smokers. Some of them former cigar smokers or hookah smokers, but most of them were smoking cigarettes. Typically less than 1% were using smokeless tobacco users, but one interesting thing that we've noticed is that a lot of the smokeless tobacco users who transition to vapor products continue to use tobacco-flavored vapor products, which we found to be interesting considering that 95% of vapor product users in a vape shop are using flavors that are not tobacco-flavored. So that was interesting. On average, less than 1% of consumers in a vape shop are tobacco naive on initiation. Most of them were cigarette smokers or tobacco users, so they have experience with it. There is generally a higher nicotine consumption among people with mental illness, and we do find a higher proportion of people with mental illness in the shops than in general, and they seem to be consuming not only higher nicotine levels but also significantly more consumption of liquid. So overall consuming more nicotine at higher levels. We also see that there's a higher percentage of people with substance use and abuse issues, and there's some surveys and studies to show that that's the case. This is a brief video from one of our customers. Hi, how are you? Can you tell us your name and how old you are?
Hi, my name is Mark Diaz and I am 31 years old.
Hi, Mark. How old were you when you started smoking cigarettes, and how many years have you been vaping now?
So I was 19 years old when I was smoking cigarettes, smoking for a total of 7 years. I switched to vaping. I have been vaping a total of 5 years.
And during that 5 years, how many cigarettes have you smoked since you started vaping?
I can proudly say I have not smoked any cigarettes since I have been vaping.
Congratulations. Very nice.
Thank
Very
you.
nice. Um, so where did you get your first vape? And was it in a vape shop? And if not, I know you've been to vape shops now, so is going to a vape shop important to you?
Going to a vape shop is very important to me, and this is because there are very key key details regarding safety of using a device that were not explained very well to me at a regular deli/bodega.
Okay. And do you think that vaping is more or less harmful to you than smoking cigarettes?
I believe vaping is less harmful, and this is because the ignition of a butane fuel lighter causes smoke emitting carbon monoxide and the ingestion of all these toxic chemicals into the body.
And so why do you personally vape? Is it only because you feel it's less harmful, or are there other reasons why you vape?
So in the long run, I was smoking so much, and I was getting nauseous and sick, unable to smoke anymore. In order to lessen the anxiety and the cravings for nicotine, vaping was better able to do that while increasing my energy and mood, while altogether lessening the harm on the whole body because there was no lighter ignition.
And what kinds of flavors do you use in your vape?
So the favorite flavor that I have been vaping is called fruit gum.
And if you only had a choice of tobacco flavor and you could no longer get any other flavor except tobacco, how do you think that would affect you?
That would be heartbreaking because it would subconsciously bring me back to a bad time, and the thoughts of tasting cigarettes, I fear I would actually, it would have the potential to make me relapse and start and pick up smoking again.
Right. Well, we can't have that. So,
Mm.
congratulations and thank you so much for your time. We really appreciate it.
Thank you for having me.
So, vape shops are absolutely imperative to the success of people at switching from smoking cigarettes to vapor products. The education and support provided in a vape shop, especially for new users, you can't get that in a smoke shop or a gas station or a bodega. This is something that's provided at vape shops, which makes people who switch in a vape shop much more likely to succeed. Um, the affordability of purchasing products in smaller purchases, purchasing a week's worth instead of a month's worth of product, makes a big difference. Not having to pay large shipping costs and ordering 1 month's worth of supplies at a time, especially for people who can't afford it, is really important. It's also important for the vape shops to be able to promote local advocacy, to maintain access to the products. People are not always aware that the government is trying to stop them from purchasing these products. They're putting flavor bans out or liquid bans out or vapor bans out, trying to get rid of the product entirely so that people will return to smoking. And it's important for us to be able to ask the consumers to reach out to their local politicians and their government officials to tell them that they use this product and they need to have access to this product and that they vote. Um, it's important also for us to counter the myths and misinformation that are put out by the media and the government and even some of the public health organizations where they're lying to the consumers. So many consumers are returning to smoking because they're hearing this information and they believe it without being able to come into the vape shops and for us to be able to provide for them data and science and research that shows them that this is not true. A lot of them will go back to smoking. We also need to be able to educate non-nicotine users about why they shouldn't just pick up nicotine as a habit. A lot of people don't really understand, and they just start using vapor products when they aren't nicotine users. And it's important for vape. A lot of vape shops, believe it or not, actually do encourage consumers not to purchase anything, or at least not to purchase anything with nicotine in it, if they're not current nicotine users. And also, really importantly, most important things really are education and support for new users and the safety precautions. When you purchase a product online or you purchase it in a shop where they don't educate you or they don't teach you anything, you don't understand how to use it. You don't understand when you have to change the coils or the atomizers on it. You don't understand how to charge it. You don't understand what not to do, which is sometimes more important than what you should do. And so it's really important for vape shops to have access to these consumers to teach them how the product works. So it is absolutely imperative to have continued accessibility to vapor products in low income areas. Although the initial cost of the device is higher, the overall cost of continued use is significantly lower. But a lot of times you need a vape shop retailer to explain this to the people that are purchasing so that they understand that they only have to spend the initial layout one time, and the continued use is so much less expensive than smoking cigarettes that this money is made up within a matter of days or weeks. Um, as long as there are not extraordinary vapor taxes on the products, the cost can be 20% or 30% of the cost of smoking cigarettes to continue to use vapor products. And once people understand this, they're much more willing to make the switch. It's also important to understand that in low-income communities, the cost and the expense to using NRTs is prohibitive to people who are living paycheck to paycheck. They can't afford to purchase the nicotine patch or the nicotine gum because they come in packages that are very expensive and have high volume, and people can't afford that. When they were buying cigarettes, they were buying one cigarette at a time, loose. So it's nearly impossible for them to afford to switch to NRTs, especially when vapor products are so much less expensive, at least in most states. There's also a higher number of smokers in these areas, and although a lot of vape shops, retail chains don't want to open in the lower income areas, it's important to realize that you're going to have a higher number of customers even though they're spending less. And so it still ends up working out well to have a shop in an area where people really need that shop, and it's important to have shops in those areas. More consumers in those areas are going to also need higher levels of nicotine. They're consuming higher nicotine levels in their liquid, but they're also consuming a higher volume of the liquid, and they're more consistent about their purchases because it's imperative for them to have that product. And so it makes it easier for those shops to maintain consistency of a customer base. I just wanted to briefly discuss coronavirus in vape shops. Many shops in the U.S. Fought for essential status in their states during the shutdown when most shops that were not essential were shut down, and most of them failed. However, cigarettes were still readily available at every gas station and corner store, which were deemed essential and easily available to consumers. So many former smokers returned to smoking, which is not good. Once things do open up back up again, I think that we're going to see that with the reduced number of consumers, because many of them went back to smoking, and a consolidation of the number of shops due to bankruptcy from lack of income over the past number of months, and governors taking emergency powers to protect people against coronavirus and using those emergency powers abusively, and passing flavor bans, which would restrict the flavors of e-cigarettes to be sold. It eliminated 95% of the sales from many of the shops, so I don't think that many of them will remain open, which is very difficult in the states where the flavor bans have passed, and there were a number of them. The one positive thing is that there was a trial run for an illegitimate underground market. Since the shops were closed, consumers had to find other ways to get their products, and the resourceful ones did, and so there is now a large underground market. Unfortunately, though, it is not regulated, it is not taxed, and it is not limited to only those who are of age to purchase. And so this is a negative for public health and unfortunate. A number of studies have showed that vape shops may aid in smoking cessation through education and support. And I think it would be interesting to see someone, I know there's a couple of studies out there showing research that showed that different purchases, whether online or in vape shops, showed different results for smoking cessation, but I'd love to see someone study the different types of vape shops and which ones seem to be most beneficial for smoking cessation so that we can know which ones are most imperative to keep available to consumers. I like to finish all of my presentations with a little picture of an apple. If I were to offer you this apple and tell you that there's a 50-50 chance that you will eventually die as a result of having eaten the apple, almost everyone would say that they don't want the apple. But every day, consumers not only smoke cigarettes, but they go out and spend hard-earned money on these cigarettes and smoke them, knowing that there's a very good chance that they're going to die as a result of having smoked these cigarettes. For many nicotine users, the benefits of the nicotine outweigh the cost and the risk of dying. And it's important for people to finally understand that nicotine abstinence is not an option for many of us. So let's try to reduce the harm and make sure that people can succeed and have quality lives with nicotine in their life. Thank you.